Paul Sullivan is a Gulf War veteran and the Executive Director of Veterans for Common Sense, a nonprofit providing government and public relations advocacy for veterans. He's well-known and frequently testifies before Congress and works tirelessly on behalf of expanding Veterans Administration care and benefits for veterans. He was the national spokesman and the executive director of the National Gulf War Resource Center. He's been an outspoken critic of the VA's benefit system, a system which hopefully we'll learn about what that is, a system that has prevented the timely delivery of both health care and benefits to many ill and struggling veterans. It's a pleasure and an honor to introduce Paul Sullivan. Thank you. You can just go B. All right. Oh, good. So you can use this or press that.
Super. Thanks. Yep. They have the microphone taped down here, so I tried to move it and it all fell down. Good morning, everyone. I'm very glad to be here, and thank you very much for the nice introduction. Before I begin, on behalf of Gulf War veterans, Bobby, Dr. White, you're truly a hero that we truly deeply respect for your research for so long. You've been in the trenches a long time with us, and we appreciate it. And for Professor Anas, I think he was here, there he is in the back. Thank you, too, for your work on ethics and for hosting this conference so that we can get the voices of our veterans out there as part of the discussion. Simply, today's topic is Coming Home Injured, Care and Advocacy for America's Veterans. I'm very glad to be joined with Anthony Hardy, who has been my friend in this fight for about 15 years, and he'll come right after me. That's what I lived in as a cavalry scout in the 1st Armored Division for 2 months, driving through minefields and sucking in black smoke like standing behind a city diesel bus from about 20 years ago before they had all these nice clean buses. It was really terrible, and I was hacking like Anthony was just there for years coming back, and still do on occasion. What is Veterans for Common Sense trying to do? We're trying to fight for our veterans so we can have access to prompt and high-quality VA care. Although I was introduced as one of VA's harshest critics, I'm also one of VA's biggest fans. I encourage veterans to go to VA for health care for Gulf War illnesses and for mental health conditions because, as one study showed, veterans who go to VA for mental health care are less likely to complete suicide. So if you know someone on the fence on an ad issue, it can save their life to go to VA. This is another friend of mine, Chris, in front of a destroyed Iraqi tank in Iraq in 1991. We didn't know it at the time, but the vehicles were covered with radioactive toxic waste. We'll get to that in a minute. A little bit of a background about Veterans for Common Sense. We were formed about 8 years ago. We're a nonprofit. And we were started by Gulf War combat veterans who had been in Iraq who questioned the rush to war in 2002 and 2003. We said, based on our own experience, there were no weapons of mass destruction in Iraq. There was no link between Iraq and 9/11. An invasion would cause a humanitarian crisis, that there would be prolonged urban combat with massive casualties. And we said VA wasn't ready. I'm not going to wag my finger and say, we told you so. Oh, I just said it. All right. In all seriousness, this was an outshoot from the Gulf War veterans who wanted to take on the foreign policy issue of the war. Now that's pretty much been set aside, and we almost now exclusively focus on advocacy for veterans. That's because the president has announced that he's winding down the war in Iraq. Now, here's what we do. We have 2 types of advocacy at Veterans for Common Sense. The first is where we go Washington, because this is a federal issue. We go after the executive branch, the legislative branch, and the courts, and we try to fight for the best policy for Gulf War vets and then to make sure that those policies are implemented. We also use public relations, and that gets our message out so people are educated. Sometimes we're not the best. I have no PR background. We just try to be veterans sharing our story, trying to say that we need care. Here's what we've been able to do in a quick summary. In the last 3 years, I've testified about 15 times. We helped, for example, blow the Walter Reed scandal. We helped blow the scandal where VA executives were paying themselves $30,000 bonuses while the number of veterans waiting for a claim decision was getting larger and the wait for the benefits was getting longer. It was truly a disgrace what these VA leaders were doing. Here's some of the things that we fought for. I met with staff with Senators Obama and Clinton and Bond and Snow and Collins and many more, and we convinced Congress to extend free care for returning war veterans to 5 years of free care. Over the last 3 years, we've seen $35 billion in increased VA appropriations. Of that, the first $1.8 billion started with me in a conversation in a Senate dining room on a napkin on how many more veterans' claims could we process and how many more veteran patients could VA see if we just added $250 million. As you can see, as an advocate, we kind of boosted the number a little bit. It came up to $1.8 billion. We've also fought for Gulf War benefits, research and care, more PTSD health care and benefits. We fought for a shorter VA claim form from 26 pages to 6 pages. Imagine 1 million claims coming in at 26 pages of paper per claim. It fills up this room in a heartbeat. We said, can we just have some common sense? And we got VA to shorten it to 6 pages. And I think really this might be on the top of the list. We're helping to change VA's culture. And I think the new administration is far more friendlier, and they're really doing some more outreach to veterans, and they're getting it. A quick summary, what am I going to talk about today? Part 1, I'm going to go over VA and DoD data. Part 2, I'm going to go over the Gulf War history and benefit laws. And Part 3, I'm going to talk about advocacy that we can maybe use in this afternoon's conversations. This presentation is geared especially toward folks with the law. And I specifically left out information about the medical stuff because there's somebody way smarter than I am in the room, Dr. White. And then Anthony Hardy will discuss what it's like to be an individual veteran. But just so you're all clear, I am one of those Gulf War veterans who went into a VA and was denied medical care repeatedly for 8 years. So that's how I got here. Part 1, what are the DoD and VA statistics for 20 years of war? I want you to know that Veterans for Common Sense is the only organization in the country that uses the Freedom of Information Act to routinely query VA and DoD on statistics. We've had to sue them from time to time to get the information we wanted. Here's what I hope you walk away with as major points, please. First, the Persian Gulf period of war actually began 20 years ago, and we are still fighting it now. And we have the legal citations down there. VA benefits for Gulf War veterans have been extended to Iraq and Afghanistan war veterans because the way the law is written. This is something that we're fighting for because if we have one period of war for the benefits, we don't have to go back and reinvent the wheel to open up another period of war and have a whole new set of benefits. Here's some other very important facts. And if anybody wants a copy of the PowerPoint, I can send this to you with all the law citations, so don't worry about trying to have to take quick notes. I see you all reading the first bullet point. 20 years of war has caused 1 million U.S. deployed veteran patients to be treated at VA. That's right. Since we started to fight in Iraq, VA has been flooded with 1 million new, unexpected patients. The cost per veteran, according to Linda Bilmes at Harvard University, that way, is about $1 million per veteran over their lifetime. With the current veterans now in the system, the estimated lifetime cost is about $1 trillion. We estimate the patient count from Iraq and Afghanistan will swell another 500,000 in the next 4 to 5 years, escalating the total cost to $1.5 trillion. There was a discussion earlier about the cost. We're going to talk about why we believe VA and DoD have fought so strenuously against Gulf War veterans. It's in part in cost. As Dr. White had in her slide, here are some of the exposures and some of the numbers that we've been able to pry from the Department of Defense regarding toxic exposures. Oil well fires and pesticides, radioactive toxic waste, experimental pills, experimental shots, chemical warfare agents, local diseases. It's a toxic soup is what we called it. Now here's the hard part. And all right, I won't out anybody. All the lawyers in the room, raise your hand. All the law students too. Okay, we got a bunch out there. DoD is really playing a lawyer's game. The Department of Defense has spent $200 million in public relations at their Deployment Health Support Directorate under a guy named Bernard Rosker and another guy named General Vesser, specifically to attack researchers, attack reporters, and attack veterans. In one case, Bernard Rosker, who was an Undersecretary of Defense for Personnel, went to New York, met with New York Times editors, and squashed stories about sick Gulf War vets. His staff called editors complaining about reporters investigating Gulf War illness. His staff gave information that was incorrect and malicious about Gulf War veterans. Now here's the simple question. If you were a large corporation, would you spend $200 million to save $1.5 trillion? And the answer is, that's what they did. There's also another little bit of a reason. The Department of Defense is linked with this myth that the Gulf War was short and that it was victorious. I am here to tell you that neither of those are true. The Gulf War is not over, and it looks like it will be another Korea where it's a stalemate where no one won. And it's going to be prohibitively expensive. It is crushing our economy. Now here's what happened furthermore in some of the DoD lawyer games. First, DoD admitted, yeah, sure, a few people were exposed, but it didn't make you sick. Then what DoD did is they intentionally blocked research, attacked researchers, and whatnot. Now here's what we've been able to glean from the Department of Defense using FOIA, Freedom of Information Act. We've sent about 3.3 million Americans to the Gulf War, Iraq War, Afghanistan War. It's all one war. And it breaks it down how many for each period. Now we've FOIA'd the Department of Veterans Affairs. Here's what happened to those of us who went. 1 million patients. And then we've broken it down into the subcategories. Here's how many claims there are. Pushing 900,000. Here's a concept that I need you all to understand, especially the lawyers and the law students. If it wasn't for the Persian Gulf Veterans Act of 1998 that Anthony and I and many others worked on, that allowed for 2 years of free health care for Gulf War veterans, the previous system required that a veteran prosecute and win a disability claim against a highly adversarial VA before the veteran could ever see a doctor for treatment. What we tried to do in our strategic plan for veterans was to fix the claim system so that the veterans could get into the healthcare system faster. What we had to do, because the claim system was so absolutely broken at the Veterans Benefits Administration, is we came up with this side route of 2 years of free healthcare. And then when we saw the claim system getting so disastrously behind, we ended up extending it to 5 years of free healthcare. If it wasn't for that 5 years of free healthcare at VA, the claim system at the Veterans Benefits Administration would have crashed and burned, no doubt about it. Now here's our summary, and Dr. White went over this. The Research Advisory Committee, which was created by the 1998 law concluded that about 210,000 veterans of the war remain ill due to deployment. In 2009, the Institute of Medicine concluded that about 250,000 veterans of the 1990-1991 Gulf War are ill, and they urged a massive increase in funding to understand and to treat Gulf War illness. Now I'm going to go into some of the history of this, and maybe I won't be so nice as Dr. White and some of her eloquent, doctor language. I'm a recovering soldier, so I'll be a little bit blunt about it. For all the law students and lawyers out there, there's a long list of laws. You can take a copy of my PowerPoint. I'm going to run over these quickly. Back in 1991, Congress allowed the U.S. Army to make an offensive attack against Iraq and Kuwait, and then the war began 3 days later. Then in April of 91, Congress retroactively set the start date of the war as the date that Iraq invaded Kuwait. Later on in 91, Congress then said, you know what, let's follow some of these veterans and see what's going on. So they had these Gulf War registries set up. In 1993, after veterans were complaining and there were press reports, Congress ordered VA to start doing more research. And that's where we started coming up with syndrome and psychological. Congress then pushed through 8 more Gulf War research laws. And what was happening? VA was fighting research. So we came up with the strategy of, you know what? We're not going to say we're sick from the exposures. We are going to have the government hire scientists like a referee and see what they find. Bring in someone objective. If you won't believe us, veterans, standing right in front of you, call in a second opinion. And that's really where the research for Dr. White and many others came in. And in VA and DOD, basically they wanted an easy answer, so they concocted the stress theory. And they mounted the $200 million PR campaign, essentially to stop Gulf War illness. 1994 saw the first time Gulf War veteran groups, about 40 or 50 of them in the country, got together and pushed for a law to change the benefit system so the veterans could be granted benefits for undiagnosable conditions so that then they could get health care. It was a disaster. VA denied virtually all of the claims. It was a nightmare. Again, DOD is continuing to pump money in to say that Gulf War veterans' illness is not real. Then in 1995, there was a huge breakthrough using this brand new thing, man, I feel old saying this, called the internet and email. And some professor wrote a study about us. We're published somewhere. We organized a conference in Dallas. That weekend, 60 Minutes ran a segment about service members exposed to chemicals, and then the Gulf War Resource Center was formed. They named me spokesman. I have no idea why. Then the Vietnam veterans gave us a lot of money to help set this up. And then Life magazine came out with their cover story about Gulf War veterans who were sick and our children born with birth defects. And then that year, DOD admitted, okay, only 500 Gulf War veterans were exposed to chemical weapons. I want to let you know that happened because I, as the head of the Gulf War veterans at that time, sent in the Freedom of Information Act request that forced the release of General Schwarzkopf's personal logs that had page after page of chemical exposure report and incident and confirmation and awards of Purple Heart medals and awards of Bronze Star medals for those sickened and then those who detected the exposures. 1997 saw a huge breakthrough for us on a law that requires the military to do pre-deployment and post-deployment exams. I regret to inform you the DOD did not begin implementing that in any way until about 2004. And now in 2010, DOD is finally starting to collect data on service members before and after they go to the war. This is important so we can better understand exposures and illnesses. In 1998, that was really the peak year for our activity in Washington. We set up an office in Washington, D.C., and the first time the phone rang, it was a guy named Bernie Sanders, who's now Senator Bernie Sanders. He was a congressman at the time. Next phone call was a guy named Bob Filner, The next phone call was a guy named Chris Shays. They then introduced a bill to help us get benefits, get health care. In June, 3 months later, the bill passes, and on Veterans Day, I'm standing with the president at the White House signing our bill. The key to victory here was actually having VA agree to be neutral and not fight us on the law. So here's what the law did. It created a two-step process. It set up the Institute of Medicine to review scientific studies about veterans, deployments, toxic exposures, and whatnot. And then in the second step, when the IOM finds an association between deployment and a medical condition, then the VA can promulgate regulations to provide care and benefits to the veterans. Under this law, VA announced recently that there are 9 conditions, 9 diseases associated with deployment. I want to let you know the law says associated. We're not looking for the standard of cause. We're not looking for the golden smoking gun. Essentially, we have to show that service members are more likely to come back with this condition than not. The other part of the law created the Research Advisory Committee that Anthony Hardy is on and Dr. White is the scientific director of. Not only did we want to have the IOM look at this, we wanted to have a second opinion to look at this. We were really trying to make sure that VA could not continue their pattern of blocking the collection of data, research, and helping vets. Then here's the dark times, 98 to 2008. It was just ugly. Take a look at the screen. VA said that they were going to do all this stuff, and it just fell apart. In 2007, VA started the Thaw. There was a Walter Reed scandal, the bonus scandal I mentioned. The secretary resigned in disgrace. VA was sued by veterans because VA was unfairly denying claims. We testified about this over and over again. And then in 2008, boy, did things change. The new law for 5 years of free health care. We forced out the Undersecretary of Benefits who was proselytizing in his office. Congress passed major claim reform, and on and on. The RAC released their report, and again, we're on national news talking about this stuff. 2009, the picture even gets better. The president announces a single VA DoD record. We ask for hearings on Gulf War veterans. We get them. VA was asked by us to reform PTSD claims, and they did. We asked VA to form a Gulf War task force. They did. And the IOM released their report. Wow, I mean, this is a lot. It takes a while for some of these advocacy efforts to bear fruit, as it takes a long time for scientific research to bear fruit. VA now announced that it will handle the PTSD claims differently. We were on CNN right after the president made the announcement. VA issued new Agent Orange regulations. They shortened the claim form. They're going to reform the undiagnosed illness benefits from '94. They released a task force report. VA announced electronic disability claims just the other day. These are huge reforms at VA. And all this comes because there are veterans who support Veterans for Common Sense, the National Gulf War Resource Center, lots of local advocacy groups, lots of press coverage, congressional hearings, medical research, and all of this had this snowball effect. So with all that good news, where do we go from here? Yes, the last 2 years have been very fantastic for veterans, but there's still a lot of work to be done. Number one on the list, more research, more treatment. We need to stop the chemical burn pits in Iraq. We need to make sure that the VA's Gulf War Task Force is done. We need VA to implement their new regulations on Gulf War veterans. And we need VA to finally start coming clean with the data. Remember I mentioned at the beginning, we have 1 million patients from the Gulf War for the last 20 years. We've had to fight under FOIA to get that. We want VA to more proactively release that. We want VA to hire more doctors. We want DoD to expand pre- and post-deployment exams. We've got our lawsuit appeal that's coming up. We'll be testifying again before Congress. Every year they call us back to ask us the same questions. Is VA getting it right? So we will be there. And then we'll continue to place pro-veteran stories with the media. That pretty much wraps up what I had. I kind of shortened it because we were running out of time. So I want Anthony to come on up, and then when we're done, we'll ask questions. We'll answer questions. Thanks.